Welcome to Pajon Imaging Hub. In today's patient and public education series, we look at mammography test, what the patient and public need to know about the test. Please remember to like, share, and subscribe to this channel so that you'll be notified when new video is released. Welcome back. What is mammography? Mammography is the use of mammography machine to examine the breast for early detection of cancer and other abnormalities. So, how do we prepare for the test when you are asked to go and do a mammogram test? One, in the morning of the test, you have to take your bath, then you don't apply cream. So, why won't you apply cream? Why were you told not to apply cream? The reason is that the deodorant or lotion or cream may cause error in the result. It may appear as a white spot on the image you are going to obtain, and that may be seen as something abnormal in your body. So that is why you are asked not to use them in the morning of the exam. Then food, you eat food if you want. The test food is not contraindicated. No caffeinated drink or cola, no tea, no coffee. What is the reason? The reason is that this substance does not affect the result we obtain, but it can cause tenderness in the breast. Some people react to it, and if you are the type, when you take it, when they'll be compressing the breast, as I will show you in a moment, you feel so much pain, and that may not allow them to compress the breast well, and that will indirectly now affect the image quality they're going to obtain and probably cause you more pain. So that is why you're asked not to take them. Then it is also good to consider your menstrual cycle in picking a date for your mammography exam. The reason is that to minimize breast tenderness, because during a menstrual period, the breasts tend to be tender, and therefore to minimize and potentially improve image quality, as I will explain above, when the breast is tender, the image quality may be compromised. So for you to get a good image quality, it is generally recommended to schedule your mammogram for the week following your menstrual period. Make it to fall in the week following your menstrual period. This is because hormonal fluctuation during menstrual cycle can cause breast tissue to become denser and more tender, particularly the week before and during your period. Think about when the period have started, the week following it, after the period have ended. Think about putting your date, picking a date for your mammogram in that period. It is better. It will not cause you much pain, and the tissue will not be that dense. When the breast tissue is dense, it may equally give us a wrong information. So these are things we need to consider in picking a date for mammogram, and that is why this letter is important for you as a patient. Then wear clothes you can easily remove. What they are going to do there is breast examination. It's only the region of the breast that is going to be exposed. Though you may be given gown, but they will not bother you with removing your skirts or your pants. It's only the clothes covering the chest area that you'll be asked to remove. So you can decide to wear maybe pants, skirts with a top, so that you can easily remove the top and be able to do your exam without wearing if you wear the kind of clothes that you may need people to come and unzip here and there, you may feel awkward in such exam. Then there are things you should tell the doctor or the radiographer that attends to you, even if they don't ask you. They are important in making judgment or arriving at decision in the test. Like, for example, one of them is pregnancy. If you're pregnant, you have to tell them so that we don't irradiate. Radiation causes harm to baby. So we don't want the baby to be affected by radiation. If you're pregnant, the doctor can consider shifting the exam to some period, even in the pregnancy, that will be more safe. During lactation, The breasts are more dense due to the presence of milk production and other tissues. Now, the density can obscure potential abnormalities on a mammogram, making it harder to detect subtle changes. I've already stated that earlier. That is not dense breast does not produce a good diagnostic quality. So lactation makes it more dense. So is it affect the result. For breastfeeding mother, this is also not that good in terms of the image quality and also for the patient. In such a case, you have to let your the radiographer doctor know. Some cases they may ask the patient to press the breast, more like breastfeed before the exam. The breast will be free up to some level of the milk content. The other one is pacemaker. If you have this in you, you have to notify them so that they will take consideration of it in attending to you. Then surgery is also important. If you have had surgery and the reason for the surgery is good, you let them know. It may form part of your risk analysis. The other one is family history of cancer. If there is somebody in your family that have died of cancer or is suffering cancer, you need to let them know. It's equally part of what is used in analyzing your risk profile for cancer. Let's look at the mammography proper. What do the radiographer do to you when you come for mammogram? Now, this image is a mammography machine, and this other one is how the breast image look like after production. These two images here. When you come inside the mammography room, they'll ask you to change to probably a gown they're going to give you, or to remove the upper part of your dress that covers the breast region to expose the breast. Now, this you see this thing here, this cone here, this upper plate here, and this lower one here. Inside it, they will put a cassette that will capture the image, more like a sensor that will capture the image there of the breast. But between this upper plate and this lower one, that is where they will put your breast. So they will turn this machine in such a way that it can bend one side to accommodate your height and your breast to be able to enter this place. So they will compress this upper plate. So the radiographer will compress these upper plates. Your breast is already here, so they will compress the upper plate to be on your breast, press firmly on your breast so that they can capture a good image. Then after which it goes to a one corner and press a button to get the image. Then they will process the image and come out with something that look like this or like this. Normally they take two views, the what we call the mediolateral and craniocaudal image of the each of the breast. And also they take image of the two breasts for comparison in most cases. They can also be other views like magnification views, spot compression views, and all that. They can take all these images to produce a better diagnosis. After this, they'll ask you to go, but before then, there is a little aftercare instruction that may be given to you. You'll be told that you may have mild or moderate pain in the breast. And when you have this, you may just take, which can last a day or two, you may just take over the counter drug such as analgesic, example, paracetamol or ibuprofen, that can solve that problem. But when the pain becomes severe, then you need to contact your clinician or the radiographer that attended to you. Also, some people have been reported to develop short throat. That can equally be solved by over the counter drug, or it can go on its own. It may just last a day or two. But when this problem persists for a longer period, then you need to contact your care provider. In some cases, there may be a callback where they discover some things in your breast images. They may put a call to you to come back for additional views like magnification views or spot compression views. just to get additional information to help them arrive at decision. Also, it is important that when you are going for mammogram, you should go with any previous mammogram film that you have. It is important to help them to analyze any previous lesion found, and also to help them to flare off suspicion they may see in the current image. There is this thing we call screening mammogram. You do here, especially where the most of the NGO goes to recruit people for screen mammogram, just to check. These are mammogram done on women with no symptoms, just to detect early breast cancer. Yeah, people that do screening mammogram, they don't have symptoms, but it's done because of the danger and the consequence of having cancer. So you are asked to come for screening in case you have, or they're able to detect something that look like cancer, so that they can start a treatment on time. Screening mammogram is done annually for women over 40 years, though depending on their risk factor. People that have a higher risk factor, the risk factor here, it means the tendency of developing cancer, they may be asked to do mammogram even when they are not up to 40 years. Another one we'll call a diagnostic mammogram. Diagnostic mammograms are used to investigate specific breast changes or abnormality detected on a screening mammogram or noticed by the patient. Diagnostic mammogram is the mammogram we do for patients that have complaint relating to their breast or any part of their body that point at possibility of breast CA, or when screening mammogram have been done on such patient and there's something found in the screening mammogram, then they can send the patient for diagnostic mammogram. Now, another difference is that diagnostic mammogram involve more images or techniques to focus on the area of concern. So in screening mammogram, they will do craniocaudal mediolateral views, that is two views. But in diagnostic mammogram, they maybe need to do more views like magnification views or spot compression views, just to get more information, since there is already a complaint or a lesion already identified in the breast. Diagnostic mammogram is rarely carried out in women aged younger than 30 years. The reason is because of the high radiographic density and radiation sensitivity of the breast tissue. There are other imaging modalities like ultrasonography that can be used at this particular point. But I want you to understand what I just said. People younger than 30 years, their breast tissue is still dense. They still have more of the breast tissue, we call glandular tissue, than the parts that contain more fat. So the glandular tissue is more dense, and a cast shadow in the image that look like a suspicious shadow. So it confuses. It's difficult to make out diagnostic image from a dense breast of a younger person. So that is why in a younger population or younger persons, they'll be asked to do other imaging modalities like ultrasonography or magnetic resonance imaging until they get to 40 years, though depending on the risk factor involved. That is all we have for today. Thank you. Like, share, and subscribe to this channel so that I'll be notified when new video is released. Bye for now.